All right, Stacey, thanks so much. Today, U.S. Senator Maria Cantwell of Washington State held a press conference with South Central Washington healthcare professionals and providers. It was to discuss the harms that would result from proposed cuts to Medicaid.
But are these cuts even going to be a reality? I attended the event today to get some more answers. Take a look.
Medicaid keeps people in my community alive.
Brenda Morgan, a Tri-Cities area home care provider, shared the story of her client, Samantha, an autistic young adult with a heart condition who needs a feeding tube for meals and medications.
And she is now afraid that she will lose me as her caregiver if Medicaid is cut. Losing Medicaid would be devastating for her and her health. And the damage doesn't stop there. If we lose a pillar of Medicaid, it will be a domino effect. I will lose my job. I give care to those who receive Medicaid. If I don't work, we don't eat.
Cantwell said in the 4th U.S. Congressional District, 70% of children and 24% of adults are covered by Medicaid, aka Apple Health.
So yes, Central Washington and our healthcare delivery system would be devastated by these proposed cuts. So now we have to say, stop with the fuzzy math, stop with the proposals, and protect Medicaid.
Other participants in Friday's roundtable included Cadillac executives, a doctor from Tri-Cities Community Health, and the executive director from Blue Mountain Heart to Heart.
It affects all of us. If emergency departments become more crowded with patients who have higher complexity illnesses, the delays affect everybody. So many in our community rely on Medicaid, but really we all do.
There is nothing about cutting Medicaid that actually helps the American people.
Now, I pulled Cantwell aside after the press conference and asked her if she was concerned that some say this is just fear-mongering.
I don't think these people would be standing here if they thought it was fear-mongering. My plan is to be very aggressive about this budget and make sure that we don't cut Medicaid, because it is a lifeblood in Central Washington here. I think it's bigger than people may understand, but it's certainly helped keeping our healthcare delivery system open and keeping people alive, so don't cut it.
Cantwell did tell me that she does want to work with Republicans who are supporting the proposed cuts and hopes to continue the conversation.